Good morning, everybody. Welcome to Good Morning with Michael, special edition Saturday, Small Business Leaders. Today we have Dr. Whit Voss, who is an Alameda chiropractic ergonomics professional. Whit graduated from the University of San Diego with a bachelor's degree. He studied at Life Chiropractic College West in Hayward, California. He kind of specializes in neck pain, knee pain, back pain, and ankle sprains. And Whit says he is a chiropractor providing mobile services to patients in Alameda and Oakland, as well as providing ergonomic assessment and planning for individuals and small businesses. He runs evidence-informed and patient-centered practice with a special focus on functional movement assessment. He uses chiropractic adjusting and soft tissue mobilization techniques to decrease pain and discomfort so that his patients can move better, feel more comfortable, being more active. This helps them decrease injury and chronic disease risk, increase their energy and productivity, who wouldn't want that, and improve their overall health and well-being for the long term. So without further ado, let me welcome Whit. Whit, welcome to the program.
Thanks for so much for having me, Michael. Appreciate it.
It's awesome. Yeah, Whit and I met at Toastmasters Club. Is it Tastemasters?
The Alameda Tongue Twisters.
Tongue Twisters. Yeah. I knew it was something with the tongue. Thanks for correcting me there. And
no problem.
And the club meets at
Acapulco Restaurant in Alameda, Central Alameda on Lincoln. We meet Tuesdays at 7, and we also meet in person at Acapulco, but we actually have a hybrid meeting. So you can also join us via Zoom, which we have linked on both of our Facebook page and also our website.
Awesome. So Whit, what can you tell me about your college background?
College background. Well, that's a very interesting kind of experience and journey that I had. Initially going into college, I had the intention of becoming a lawyer. So
Oh, wow.
Yeah, so I got my, apologies, just had some notifications pop up. So I got my bachelor's in history with the intention of going on to law school. That didn't really pan out. So I was working at Costco as a cashier already. So I kind of continued on that. And over the course of experiences that my wife had, she got me convinced that chiropractic might be a career that I would be able to succeed in and find some fulfillment in as well, which is really what I was looking for. And after seeing a chiropractor for the first time, I had this really interesting experience where the chronic insomnia I had my entire life went away like overnight.
Oh, wow. That's amazing.
Yeah, it was, from that moment on, I was like, all right, all in, we're going for it. So that's really kind of where I'm coming from. And I have made it my focus in my career thus far to encourage people to move as much as they can in the ways that they feel comfortable doing. And I have, yeah, so that's, to answer your question, went off on a little tangent there, apologize. But
no
so
problem.
Then I ended up going to Life Chiropractic College West down in Hayward and graduated cum laude from there.
Oh,
and
wow.
Since then,
that's awesome.
Thank you. Yeah. It's some hard work. It's grad school. It's some hard work in there. And in the second quarter I was there, I think we had my daughter. So I had shared responsibility with my wife for my daughter throughout school. And after I graduated, it was December of 2020, which was, of course, the best year to graduate from school. So I So, given kind of everything that was happening, I came across a mobile chiropractors forum on Facebook, and it was something that I could really see doing, and finding a different um, finding a different population of people who maybe would go see a chiropractor if not for the time commitment and for the energy output that they would need to do. So I've really focused in on helping people who don't really have the time to go see a chiropractor, and they want to use their time and energy a different way. So that's those are the people that I've mostly focused on and who I mostly see.
That's awesome. So you got a home-based chiropractic office there, where you told me before we started that you mostly adjust your wife on
Yeah.
the bench back there.
Yeah, yeah. I
What
don't
is that phrase on the wall back there?
Oh, so that actually, we recently moved into the house that we're in now in last October, and on the wall, somebody had already put a phrase, and it says, "Don't mistake motion for progress, build transparency into everything." And don't mistake motion for progress, I think, is one of the things that really hit home for me, because I do like to focus on movement and functional movement as well. So when it comes to chiropractic adjusting, we get motion into the body, but we have to support the person to continue on to develop and improve the way that they move. So yeah, we're going to make some great improvements with chiropractic adjusting, with those soft tissue mobilization techniques that we do in the office and at those appointments. But it's also the things that happen outside of those appointments, the active care that we give, the exercises and stretches, and the lifestyle recommendations that we give to people that I give to people that can really help them take what we do in the office and just supercharge it for their life.
Well, that's great. That's a great incorporation of that phrase and what you do there. I think that's awesome that you keep it up there.
Yeah, I thought I was like, hey, it's already done for me. That's great. One less thing on my list.
And do you have a physical office in Alameda?
Presently, I do what I call a pop-up clinic at an office on Santa Clara. Let's see, it was 2233. It's the Mansard building, and I use an office there that a very kind massage therapist has allowed me to utilize to see some of my patients. The majority of my patients I do see at their homes, but some patients do like to come to an office as well. So I like to have that option available for them.
So, I know there's so I don't know what you call it, but some massage therapists uh, kind of fight against chiropractic and chiropractic against massage therapists. Could you just express your feelings on that conundrum?
The perspective that I have is we all have our place in the grand scheme of things when it comes to helping patients. And one of the things that's really great about massage is it can really help people to address kind of chronic tightness and issues that they have. But one of the things that I do tell my patients is tight muscles are oftentimes tired muscles, or they're trying to create stability in a place where maybe there is some stability issues. So the brain is the controller of everything. It's reading, it's getting information from your body, it's making changes, it's contracting muscles, it's moving your body in ways that will allow you to achieve whatever you're trying to achieve. And when it comes to massage therapy, I oftentimes recommend that in addition to getting chiropractic care, simply because it can be a really big benefit when it comes to decreasing inflammation, for example, or just improving the range of motion or the chronic tightness that somebody may have in those muscles while we're working on improving the endurance of those muscles. And one of the big things that I love is that there are so many different ways to address multiple issues and complex issues, especially that people might have. So it's not just, only see one person or only see another person. It's depending on what you need, we want to make sure that we're pairing you up with the right additional modalities. And in addition to that, one of the big things I talk about with my patients, and that people, especially over the age of 30, really know, is that our bodies start to almost feel like they stiffen up. One of the ways I would describe the way that my body felt in my mid and late 20s was it would feel like it was both very stiff and also falling apart at the same time. And when I tell people that, they kind of have like a little light bulb go off, and they're like, yeah, that's exactly how it feels. Because as we get older, we don't move as much. And so when we don't move as much, our muscles and our body is going to stiffen up because we have to maintain movement in order to maintain flexibility and mobility within our bodies. So to answer your question, I love massage therapists. I love acupuncture. I love physical therapy. And there's a place for each and every one of these things. And of course, I love chiropractic. We have a place for each and every one of these things, depending on what that person needs, which is what it means for me to have a patient-centered practice. Whatever that patient needs, I need to be able to direct them in the place where I think it would best serve them to go, in addition to what we're doing in my office.
Great answer.
Or in the appointments with me, because we're not always in an office.
So since you introduced your wife idea in the beginning, but what does your wife do as a career?
She is actually also a chiropractor. She works
Oh,
here
wow.
in town. Yeah, she works here in town. She's a pediatric chiropractor, and she does functional neurology with kids who have behavioral, emotional, um, or other difficulties that they're looking to address and hopefully deal with, and helping support the families who are also the families who have these kids as well. She does a lot to support the parents and kids, which is really fantastic.
So I'm sure she feels really proud of you, what you've done, and in some ways maybe giving herself a pat on the back for encouraging you to go on that route.
Yeah, exactly. If not for her, I would not be here where I am today in many ways, in many, many ways.
So since you're both in chiropractic, do you have conversations about different things from each other's practice, just getting a point of view, or questions that
Yeah,
maybe you weren't able to understand why something wasn't working this way or that way?
yeah, we definitely have, like, if there's some exercises or something that she might want to incorporate with some of her patients. Most of her patients are, of course, kids, so they're not generally needing a lot of rehabilitative exercises for what we would call musculoskeletal pain issues. But there's definitely been some times where we discuss, of course, without discussing specific patients, because that would be a HIPAA issue, which is HIPAA is the basically patient information privacy
Right.
laws and regulations. So we will definitely discuss. I love hearing from her about all of the fun. I'm actually taking a continuing education course right now on primitive reflexes, because she's encouraged, because a lot of the things that she's talked about, I can definitely see being with the work she does with primitive reflexes. Primitive reflexes are the reflexes we are born with that help us survive. And these should be incorporated within our neurology, and they should go away as we get older. Most of them going away by the time we're 1 to 2 years old. But sometimes retained reflexes can or reflexes that have kind of bubbled back up to the surface after a trauma, or I don't know, maybe having a pandemic for the last 3 years, can definitely affect how someone is able to do exercises I might give them for rehabilitation. So because of her, I've actually started looking into some primitive reflex and primitive reflex integration for my patients as well. So we definitely have a lot of differences in our practices, but we also have some ways that we can support and help each other as well, which is really, really fantastic. I love it.
So you brought up continuing education. That was one of question I was going to ask you. How often do you need to do continuing education, and how do you decide, or who decides what courses that you should take?
So yeah, in the state of California, chiropractors are required to do 24 hours of continuing education every year. Up to half of those are allowed to be online, but half of those have to be in person. And as long as the person putting on the continuing education seminar or event, as long as they've registered in California to allow it with the state board, it can be counted as a continuing education part of the continuing education hours. Now, 2 hours of automatically required 2 hours of my continuing education every year is required to be in ethics and jurisprudence of chiropractic in California, which is, it can have to do with billing, coding, generally ethics and legal things that we want to know. I did Toastmasters. And when it comes to, so the ethics and jurisprudence is the only thing that the state says it absolutely has to be there, period, end of story. The other 22 hours can be pretty much anything that you would want that has to do with treatment or assessment or exams with our patients. For me, this year I've done, let's say I did an adjusting seminar. I did an assessment seminar as well for my online. And I think I have about 5 more hours that I need to do for my continuing education this year. So we are required to continue on with our education and learn new things, including adjusting, assessment, exams, reading, x-rays, and many different categories that we can learn more in to help our patients.
Is there like chiropractic association that you belong to where you network with other, chiropractors? Maybe they've been in their profession for a while.
I do. I'm not part of my state association. That is something that is on my very long list of things to get into and pay for. But I am part of a few different organizations that are focused on the things that I'm focused on in my practice. And one of them is called the Forward Thinking Chiropractors Alliance. And they have a Facebook group. We have just over 10,000 members in there, which is really fantastic.
Oh, wow.
And yeah, there's some really incredibly smart, incredibly experienced people in there that can you can share with your patients. If your patient gives you permission, we can share, hey, I have a patient and I'm doing this, 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 and this, and we're not really seeing results. What else could I possibly look at? And you'll have people coming in from multiple different specialties saying, this is something you might look at, this is something you might look at, this is something you might look at. And it has been an invaluable experience for me. And in addition to that, I'm part of an organization called the Chiropractic Success Academy, which is an organization that supports chiropractors in their marketing, in their systems, in improving their skills in office with their patients, improving communication. And they're actually the ones they were the last ones to suggest that I do Toastmasters in order to help with my communication, especially with my patients and especially in my community.
That's awesome. So your teachers, do you ever get back together with them? Do you ever run tough question by them? How's
Uh,
your relationship with them?
Most of my instructors, a lot of my instructors, I did not really keep in touch with. I didn't have a lot of very close relationships with a lot of the instructors I had, not because of any particular reason, simply because I was so busy otherwise that it was a little bit difficult to me for me to cultivate those relationships while I was in school. But there are definitely some chiropractors who, through the FTCA, who I've connected with, who I feel comfortable going to when I do have things that I want to discuss when it comes to practice, or sometimes a little bit of life experience when it comes to work-life balance and making sure that I'm reaching the goals that I'm setting for myself as well.
So when you started your practice, how did you go about finding clients?
The first thing I did was I made a and I don't think I would ever do this again, but I made some door hangers and I just walked, I think I made 1,000 of them, and I
Oh,
just
wow.
walked around oh yeah, I just walked around Alameda, kind of, scoping out neighborhoods that I thought might have some people who do work from home and that sort of thing. And just, started flyering a bunch of different places. I've gotten a couple people from Yelp. There's a chiropractor in town who has, their practice was totally full a couple years ago. So they started filtering in, referring people to me instead,
Oh,
because
that's
they didn't
nice.
have any room in the practice. And if somebody's like, I need someone now, they're like, okay, here, go to Whit. And I've I've had a couple, patient referrals. I've had some spousal referrals. So I see one spouse and they're like, "Hey, you need to see my husband or wife because they have this issue, and I want them to also be able to experience getting that relief and helping them improve how they're moving and feeling." So I'm going to be honest, I've gotten them from just about everywhere. But in the beginning, it was definitely a bit difficult because the most common ways that we tend to find people networking and out to community activities. And of course, I started my practice in June of 2021. And at that point, we weren't really there weren't a lot of community events around point. So I've since been able to engage a lot more in community events, which has been very beneficial for me.
Okay. Um, do you have any thing you'd like to share that we haven't discussed yet?
Sorry, what was that?
Did you have anything you wanted to discuss that we haven't covered?
I don't think so. I don't have anything in particular that I can think of.
Okay. Um, so, well, I really appreciate you being here, Whit. Um, Once again, this has been Whit Voss, Dr. Whit Voss, Alameda. Um, how could somebody get in contact with you, Whit, if they were interested in furthering the discussion?
Yeah, if anyone would like to get in contact with me, they can of course give me a call, which is number 510 671 1716. My email is and the Witty, Witty spelled Whitty, Chiro, Chiro at Gmail. And my email is the same, thewittychiro.com. And if you just Google my name, then it should pop up with my information as well. I think there's me and there's somebody with a similar name, but they live in Washington, DC.
Okay. Well, awesome. Well, Dr. Whit Voss, we appreciate you joining us today with small business leadership today, and we look forward to talking and continuing the conversation at Toastmasters. And maybe some of our people out there would like to join us as well. So that's our show for today, and we look forward to seeing you folks next week when we continue our financial discussion.
Thank you, Michael.
Thank you, Whit.